So just like Sarah mentioned, my name is Deepika. Most of you, or some of you know me from my previous visits here, and some of you definitely look familiar to me. So the topic I'm presenting today is the power of resilience in stroke recovery. So as some of you may know already, I'm a stroke survivor, cancer, colorectal cancer survivor, and a neurologist at KU Medical Center. So as a neurologist who has cared for thousands of stroke patients, I once understood stroke primarily from a clinical perspective. But now, however, living through the stroke myself has provided me a profound first-hand insight of the emotional and physical challenges that a survivor faces, deepening my empathy and reinforcing the importance and holistic care in stroke recovery. So today, as I said, I will be talking about the power of resilience in stroke recovery. So first of all, okay, I will use the clicker.
But you're gonna have to minimize real quick. I'll try.
Okay. So what is resilience? Resilience refers to the ability to adapt, bounce back, and thrive in the face of adversity, trauma, or significant challenges. It's basically a mindset or a set of skills that help the individual to fight the challenges of recovery with a positive attitude. So resilience plays a crucial role in stroke recovery. Resilience and recovery are related concepts, but they have distinct meaning and implications, particularly in the context of trauma, health, or challenging life events. So in the context of stroke, resilience, it enables us to adapt to the changes that are caused by stroke, such as physical limitations, losing independence, cognitive challenges. It promotes the stroke survivor to actively seek ways to maintain their independence and engage in rehabilitation. It provides psychological and emotional foundation needed to navigate the challenges and uncertainties that come with the aftermath of a stroke and helps find a new source of joy and purpose in life. On the other hand, recovery, it involves the medical and therapeutic processes. It includes recovery, it includes therapies, like physical therapy, occupational, speech, cognitive therapy. It includes medications and other medical interventions. Before talking about resilience, let's talk about stroke briefly. So what is stroke? As we all know that it's a life-threatening condition that damages the brain by either a blood clot or bleeding. Stroke is a major contributor of long-term disability and has significant impact on healthcare system and individuals' quality of life. So in the United States, according to the Center of Disease Control and Prevention, approximately 800,000 people experience a new stroke or a recurrent stroke every year. This translates into about 1 every 40 seconds. So all of us here, you, me, we all are 1 in 800,000 in that particular year, or 1 out of that 40-second count. That is scary. It is the 5th most common cause of death in the United States. That makes it about 1 every 3 minutes, almost someone dies of stroke here in the US. So how stroke affects you? It can affect you in many ways. Briefly talking about the various effects of stroke. Physically, it can cause weakness, sensory loss, balance problems. Communication-wise, it can cause aphasia, which is the impairment or in the ability to use or comprehend words, or apraxia, verbal apraxia, which causes difficulty producing desired speech, using the correct rhythm of speech or the rate of speech. Dysarthria, which is a slurred speech. It can cause mental challenges like memory problems or emotional and behavior challenges like post-stroke depression, anxiety, which is surprisingly, it has a high number. At least 1/3 to 1/2 of stroke survivors are affected with post-stroke depression or anxiety. And it is, for some reason, it is one of the most less addressed or inadequately addressed and managed topic. Then pseudobulbar affect, which is also known as emotional lability, which comprises of involuntary laughter or crying. Just involuntary emotional expression disorder. It almost occurs in 30% of stroke survivors. PBA or pseudobulbar affect. It is very seen and very commonly in neurological disorders like stroke, ALS, Parkinson's disease, to name a few. And then socially, stroke affects you. It causes challenges with career, financial challenges. It causes low self-esteem. You don't feel like engaging with people anymore, and it can cause social isolation. And then it can also affect your relationships. But the good thing is stroke is preventable. Stroke is treatable. Stroke recovery is not limited. And always remember that stroke recovery has no expiration date. So always keep hope, stay strong, and never give up. So how resilience impacts a stroke survivor? It reduces the emotional distress by helping manage emotions like frustration, anxiety, and depression. It promotes acceptance to all the new changes that has come with the stroke. It enhances coping strategies. It helps to set realistic goals by providing motivation and a sense of purpose. It helps to overcome the setbacks. Now, come on, every person on this earth has good days and bad days. So it is very important not to lose optimism during setbacks. And then it helps build strong support networks by reducing isolation and offering emotional support. Not only that, but resilience also helps in maintaining a positive mindset by reducing negative thoughts, patterns, and by promoting hope. It improves self-advocacy. A person who's resilient is able to communicate their needs effectively. It enhances the quality of life and gives a meaning and purpose to life. And it just empowers self-care, makes you more active physically, makes you more motivated to take care of yourself, have a balanced diet, relaxation, sleeping well, socializing more, just overall taking care of yourself better. But then the question is, how do we build resilience, right? So when it comes to building resilience, the first and foremost is building emotional resilience. So how do we do that? The first is acknowledge and express emotions openly. Bottling up your feelings can lead to increased emotional distress. Sharing your feelings, share your emotions, whatever is bothering you. Vent out your feelings to anyone who you may want to, maybe a friend, a family member, or if not so, then take professional help. Talk to a counselor or a therapist. Therapy can provide valuable strategies for the coping, how to cope up with emotions. Then join a peer support group. That is one of the best ways to get your heart light, by sharing your experiences and hearing from others who have faced similar challenges. You can reduce feelings of isolation and provide emotional support. Practice meditation and mindfulness. That helps to stay positive, and eventually it helps you to manage stress and anxiety and helps you relax. Another big way to build your emotional resilience or just motivate yourself is to celebrate even a small wins. So this is something I learned from my personal experience. Early on, when I was in inpatient rehab, I was still wheelchair bound, bed bound and wheelchair bound. And one day I could suddenly get up from the wheelchair, just barely, and I slumped back. And everybody, I So everybody was clapping, and the therapist was so happy. And I was still having a frown face that what is this? This is nothing. And that's when the therapist told me that it is a win. It is a big win. So stop comparing yourself from what you were before the stroke and what you are now. Because if you do that, you'll be never happy with your progress. So always compare yourself with what you are now to what you were after the stroke, because then every day, yes, there is an improvement, and that provides you so much satisfaction. And yes, that was true, and that is when I learned this strategy of celebrating even small wins. And then the other thing is develop coping strategies like deep breathing, journaling, write down, pen down on a piece of paper what all your thoughts are, and then communicating. Not only this, take care of yourself. Oh, I lost the mouse. Okay, there it is. Take care of yourself. Self-care practices like be active, be physically active, eat healthy, have a good sleep, take your medications on time, positive self-talk, talk to yourself positive. This helps to boost self-esteem. Practice gratitude and focus on the positive aspects of life. It helps to shift perspective and promote emotional well-being. And then last, but not the least, always stay informed. Try to learn or know as much as you can about this new part of your life, the stroke. So, talking briefly about mindfulness. So, what is mindfulness? It's a simple mental practice that involves paying full attention to what's happening right now without thinking about the past or worrying about the future. Yes, easier said than done, right? But all it involves is paying attention to your thoughts, feelings, bodily sensations, breaths, and the surrounding environment. They are not asking you to not think anything, because it's impossible to stop the mind from running in several directions. But as all you need to do is sit in a quiet place and just pay attention to what kind of thoughts are there. What is your body feeling? Is it sore somewhere, or is it hurting, or does it need to relax? Breathe in, breathe out, and then acknowledge what all is happening in your surroundings. If a dog is barking, let him bark. Are there birds chirping? I mean, just realizing this, all it teaches you to slow down the racing thoughts, let go of negativity, and calm down both your mind and your body. On the same hand, just like there are breathing exercises or meditation and mantras, some people like to practice mindfulness in more active ways. So for them, yoga or tai chi, those are the other forms of mindfulness practices out there. So I have a good source for you guys, all of you. So for mindfulness, there are mean, there are many, there are several apps out there, but these are the one of few of my favorite ones. So first is mindfulness coach. It is for a beginner. It talks to you, or I mean, there is a small things about what mindfulness is, how you can practice mindfulness, what kind of environment you need, what is the body posture you need. And then it has small audios on mindfulness, which guides you as you are practicing mindfulness. And believe me, I mean, mindfulness, it just takes 10 minutes out of your day, but it really works. And I have proof for that how it works. The other app is Insight Timer that also does the same. Breathing app is another one. Then there's a website, mindful.org. These four are available free of cost. Calm and Headspace are well-known and pretty popular, famous Calm apps and websites for mindfulness and meditation with an annual or a monthly charges. Or if you don't want to do all of those, download an app, just go to YouTube and then just type in Tamara Levitt. Tamara Levitt, she is an author and a famous mindfulness instructor, and she's the voiceover narrator of the Calm app. So just type in her name on YouTube, and you will get thousands of videos. And the one I have it on site is her channel, Daily Calm, and she has like these 10 minutes videos or audios for mindfulness. That, I mean, all it takes is just 10-15 minutes out of your day. And now I said that I have proof that it works. So I don't have, I mean, the American Stroke Association or the American Heart Association. This is directly, I got it from the website. It's a copy paste, not even a single word is mine. So they say that some research suggests that meditation physically changes the brain and could help increase the ability to process information, slow the cognitive effects of aging, reduce inflammation, support immune system, reduce symptoms of menopause, control the brain's response to pain, and improve sleeping. They say that more research is needed, but it's clear that meditation effects on the body and brain are a no-brainer. So it is real that meditation is physically changing the brain. So all it takes is 10 to 15 minutes out of your day. And also I have a resource for if you are looking for, or if you want a counselor or a therapist. This is a very good website. My therapist told me about this website when I was asking her as a resource to share with my patients in the clinic. So psychologytoday.com, and then in this website, you just need to put your zip code, and it gives you a list of lots of therapists, and then it also tells you that if they have online appointments, and then if they accept insurance or not. All you need to do is just pull up the website, put in your zip code, make a phone call that to the therapist. And also the website gives you information on what areas that particular therapist specializes in. Now talking about physical resilience. So of course, therapies, yes, do therapies like you all are doing therapies 3 times a week. That is great. But what else can you do at home? Regular activities based on your abilities and limitations, like walking. If it is the good weather, walk in the yard or go to a park. If you are a water person or you like swimming, go to a pool, or just even seated exercises with some weights. That helps with cardiovascular fitness and muscle strength. The other important thing is using rehabilitation equipments, using assistive devices like cane or walker or a wheelchair. In the clinic, every day I encounter a lot of patients who are told to use a cane or a walker, but their spouse or their family members complain that they don't use it. And when I ask the patient, the answer I get is, I don't feel like using it, or I feel embarrassed using it. Well, these aids are to enhance your safety and independence. So use the aids your therapist has recommended. And then get your home modifications done. Simple things like grab bars in the shower, or something to sit on in the shower, or building ramps or non-slip floors. I mean, yes, I have used a chair in my shower for months after my stroke. There is no, I mean, it's better than falling down and breaking a bone. So yes, I mean, get modifications done if needed. And then you can do some strengthening exercises using a resistance band or light weights or just body weight exercises. And then one of the things which is very, very important for all stroke survivors or any brain injury patient is stretching exercises. Especially for stroke, we all have increased tone because of the stroke, spasticity. So that is where all the stretching exercises are really important. So how do we get to know these exercises? What is good or not? What is bad? Yes, you have Musna, but I will, there's another source that you will get. Yeah. Okay, so some more exercises, balance exercises. So for that, you can use a foam pad, just something very simple. You can use it at home. Then coordination exercises like tossing a ball, or if you have grandkids playing video games, play some video games with your grandkids. The video games, it improves your motor skills and coordination. And then if you have access to heated pool, do some water therapy. But then always focus the importance of rest and recovery. Sleep enough, at least every adult should sleep for 7 to 9 hours a night. Keep yourself well hydrated. Drink at least 60 to 80 ounces of water or fluids a day. By fluids, it does not include alcohol or caffeine. Yeah, it can include juices, vegetable juices, fruit juices, electrolytes, or water. And then stay motivated. So yes, so where to find all these exercises? So I found a very good YouTube resource again. So go to YouTube and type in Dr. Tara Tobias or type in Rehab HQ. So this is a YouTube channel or a channel which is uh, formed by a neurologic physical therapy. Her name is Dr. Tara Tobias, and she's in Florida. And I have used her channel. I follow her exercises. They are so great. She has about thousands of videos on spasticity, stretching exercises, balance exercises, you name it, she has it. Exercises for foot drop, wrist drop, knee, everything on earth. She has videos for that. And yes, I mean, you can definitely get exercises. But then one thing I would suggest is that if you are doing some of the exercises and you are little unsure about if it is right for you or not, run it by Musna that is this correct for you or all right, so going to cognitive resilience, and so that brings the interesting topic of neuroplasticity. So I'm sure you guys have heard about neuroplasticity. Yes, I'm seeing some nods, yes. So neuroplasticity is our brain's remarkable ability to reorganize and adapt by forming new neural connections throughout life. So it happens in everyone. Because of neuroplasticity, we all learn to adjust. We all adjust to learning, recover from injuries, adapt to changes. So it basically underlies learning and memory processes, or what we, in lay terms, what we call as memory, muscle memory. It plays the most important role in stroke recovery. But how? How can our brain regrow and regenerate? Well, not exactly. So neuroplasticity, it means it creates new neurons throughout life in everyone. More so in someone where there is an injury to the brain. More neurons, it forms more neurons and their synaptic connections or connections, that means connections between the neurons. So wait, you might wonder that does that mean that we all can just sit and wait and let the brain do all the work and neuroplasticity form all the new neurons and we don't have to do anything? Unfortunately, in the modern world, nothing is free. So how can we promote neuroplasticity? Well, of course, by therapies. Then there is something called as constraint-induced movement therapy, or in simple words, use the affected limb. So either every day or maybe some few times a week, try to constrain your the good arm, the unaffected arm, maybe tie it or put it in a glove, or ask a family member to constrain it that you cannot use it, and then try to use the affected arm. So basically, it is like using your affected arm for activities. This approach can stimulate neuroplasticity in the motor region of the brain. Then likewise, there is mirror therapy. So what is mirror therapy? So mirror therapy uses a mirror to create an illusion. So actually, like you can see in the picture here, this woman is doing the activities by her unaffected arm. But she's seeing the image, so it is like creating an illusion that her left arm is also doing the same thing. So it is actually creating an illusion of the movement in her affected limb. This technique can enhance motor recovery by retraining the brain to perceive movement in the brain in the stroke affected areas. Then the other thing is mental practice and visualization. Mentally rehearse the movement or activities that you find challenging. For example, just like sitting and visualizing with your eyes closed, visualize that you are uh, holding something with your right hand, if you have right arm affected, and you're drinking water with the by holding, grasping a glass in your hand and drinking water. So that also, that visualization can also activate the brain regions associated with motor planning and execution. And then, of course, repetitive tasks. Repetition, repetition, and more repetition. That that is the main thing that helps with neuroplasticity. Aerobic exercises play a big role. By engaging in aerobic exercises, you can increase blood flow and oxygenation to the brain, supporting cognitive and motor recovery. And then for sensory stimulation, massaging the uh, massaging the affected area, or using hot or cold therapy, or just some textured materials can help reawaken the sensory pathways and it can also promote neuroplasticity. Other things that can promote neuroplasticity is social engagement. Be a part of the social activities, be a part of stroke support group, or just any kind of social activity. It stimulates brain activity and motivation. Using, again, back to using your assistive devices, they make you more functional, and they help you regain your independence. Consistency and patience. Neuroplasticity and stroke recovery takes time. As it is said that stroke recovery is a marathon, not a sprint. And then leading a healthy lifestyle, eating a balanced diet, staying physically active, managing stress, uh, get adequate sleep, yada, 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 all the same things, what I told, managing good hydration. I mean, again, always the same things. And then emotional well-being. Seek emotional support if you need. So the key to promoting neuroplasticity is regular and purposeful activity combined with patience and a positive outlook on recovery, on the journey of recovery. And lastly is the social connections and learning. So as I said that being social helps with mood, listening to others helps validate your feelings, your symptoms, you're able to recognize your symptoms better. It's good to know what you are dealing with. And then the resources are endless, but always go to reliable sources and authentic resources. So one of the good resource I have found is, of course, the American Stroke Foundation. So if you go to the American Stroke Foundation, Stroke Connection e-news, or just Google Stroke Connection e-news. I don't know if this, okay, let's just go to the screenshots I have. So if you type in Stroke Connections e-news, it will take you to this page. So this is a very good area of information. So here there are like tips for daily living. And if you scroll down the page, it will give you daily tips, shopping tips, or bathing tips, driving after stroke, and there is a how-to on pretty much everything in life that is affected after stroke. The other thing, one of the other thing I found in this stroke e-connection part of the stroke foundation, the stroke association is Stroke Onward. This is a group, an organization, a non-profit organization formed by a stroke survivor, the woman, the stroke survivor. She is Deborah Myerson and her husband, and I'll talk about them in a little bit. But they also talk a lot about all the emotional, just how stroke has affected them and affects everyone in what all things stroke can affect, how to overcome them, how caretakers can be involved. Then the other thing is you can look for local support groups. If you just type in the zip code, you'll find the stroke support group. Here in Kansas City, you don't need to go far for a support group. We are a support group available for you guys. I'm sure this is not the first time you're hearing about the stroke support group formed by the University of Kansas Health System and PAM Rehab. So this support group is led by Sarah Lanston and myself and PAM Rehab. And we meet every third Wednesday from 6 to 7 p.m. This is our physical address, but we are also available virtually. And then the other other support you can find on this stroke connection is online support groups. For this, you have to make an account. So it will ask you certain things, your name, your email address, your address. And then once you register, it has unlimited resources. I mean, it has unlimited strokes support, just like online, like blog or discussion about if you have any kind of question, you can just post your question like on stroke. You can go in, you can post your question or answer somebody else's question if you have. This is a great way. It's just like social media. And then just a last resource I would like to share is about books. There are like a few books which I really like and would like to promote. I've got copies of these books, one copy of each of them for you guys here. So you can get them and share them with each other. So this one is identity theft. This is the one I was talking about with by the author is Deborah Meyerson, Dr. Deborah Meyerson, who's a fellow stroke survivor. She was an ex-professor at Stanford University. She has documented her emotional journey, answered questions like, who am I? I mean, I'm sure we all stroke survivors have this question. And then we all are trying to answer the question for how do I rebuild a meaningful and rewarding life? Well, I'm still there, I'm searching the answer. And then she has very good information for stroke survivors as well. And then their website strokeonwards.org is also, I've mentioned there. And then the next one is actually, this is by author is Angie Reed. She's actually a local Kansas City. She lives in Kansas City. She's a fellow stroke survivor, and we came to know about her a month ago. And she talks openly about her post-stroke depression, her stress, anxiety from her personal experience, how to recognize, how to manage your mental health challenges. And then she also talks about what a caretaker can do. She has powerful cognitive strategies and the what you can do to enhance your cognitive. Sorry?
Is that a good book to read if you haven't had a stroke?
Oh, yes, yes. These books are good for even for someone who does not have stroke. Yes, yes, definitely. And it is good for stroke survivors, caregivers, and for anyone. Yes. And then this one is stronger after stroke. This is by a researcher, Dr. Peter Levine, who's a researcher, clinician, and a professor. And he talks about how to maximize your recovery. Talks in great detail about neuroplasticity, latest research insights applied to individual recovery programs. a lot of DIY strategies or to save time and money. Talks about E-stem, reducing post-stroke pain, understanding spasticity. So this is also another good book. And then this is something which is written by Dr. Lewis Kaplan, who's a neurologist and a fellow of American Academy of Neurology. So American Academy of Neurology, it's the biggest world organization which all neurologists are a part of this academy. So he talks in great detail about the anatomy of brain, about the types of stroke, about the treatment of stroke, recovery from stroke, little bit more of a medical book, but in in plain English. So, I mean, you don't have to read it in you don't need to know every part of the brain, but at least you can read what applies to you and what part you are, interested in. And then this one is another book by Angie Reid, the local book author, about mental health hacks, where she's written about 10 ways how you can emotionally control your mental health problems. So these are my resources for you guys, and with this, I'll stop and thank you and put in. I'm here for any questions.